Welcome everyone to this webinar on deliberate practice for psychodynamic therapy. Webinar number 1 of this series. We're going to do several of these with the wonderful, lovely Hannah Levinson here with us, guest expert extraordinaire. My name is Alex Vash. I'm with my wonderful colleague and friend, Tony Romaner, and I'll just jump right in and present Hannah. So Hannah Levinson is professor at the Wright Institute in Berkeley, California. She has specialized in brief dynamic therapy and supervision for over 40 years. She has authored over 85 professional papers and 4 books, actually soon to be 6 books, more on that later, and has released several videos with APA illustrating her approach. Aside from that, she's just a wonderful person. And also, I should say now, basically a deliberate practice expert. So thank you so much for being with us, Hannah.
My pleasure indeed.
Tony, you want to take it away here?
Yeah, sure. Alex and I are with Sentio. We have an online counseling center in California with a few dozen trainees, and we run a year-long intensive supervisor training where we will teach you on how to use deliberate practice in your supervision. It is for residents of California and then also Washington State. We're opening a branch there as well. So if this interests you, please contact us through the website on the screen. Thank you.
All right. So let's jump right in. We always like to start with a single slide summarizing why this matters. Why does deliberate practice matter for the field of psychotherapy? So we make the basic distinction between conceptual learning or conceptual knowledge or conceptual teaching and procedural learning. Conceptual learning being the type of learning that you do through reflecting, thinking, reflecting about concepts, reading about theories, for example, discussing with peers and colleagues, going to lectures, hearing myself talk right now. All of this is conceptual learning. And that contrasts with procedural learning, which basically means learning by doing, right? So for example, you can see behind me, I have a bunch of guitars and a piano. If I were to learn to play the piano, it's one thing to read about the piano in a book or see YouTube videos on other people playing the piano. Whole other thing, me actually playing the piano, practicing it, right? We argue, and we are definitely not the first ones, we're actually late to the game, that psychotherapy needs both. We need both conceptual learning or conceptual teaching to learn the theories and models, case formulation, etc. But we also need procedural learning. We need more skills training, basically. And that is often lacking in our field. Most of our field's training resources are focused on conceptual teaching methods. So we're trying to balance it out a little bit and create resources for procedural learning of therapy skills. So how are we doing this? In many different ways, but one of the main ones is Tony and myself are editors of this American Psychological Association series, what I like to call the Rainbow series because of all the nice colors. And we are up to God knows how many books at this point. It's one book per therapy model. And we have the incredible luxury of working with experts from different therapy models and create deliberate practice skill building exercises for each of these therapy models. Now, Hannah and her 2 colleagues, Volney Gay and Jeffrey Binder, are authors of the Deliberate Practice in Psychodynamic Psychotherapy book. And I just want to again extend an incredible congratulations to them because out of all the books and all the therapy models, trying to synthesize the rich history of the model into 12 skill building exercises, which of course is not comprehensive a list at all, nor should it be, still was a Herculean effort. So kudos to Hannah and her co-authors. And that's what we're going to be focusing on today. We're going to be focusing on a particular skill from this recently published book by the APA. And so just to give people an overview of the skills in Hannah and her colleagues' book, these are the 12 skill building exercises on this deliberate practice book for psychodynamic therapy. Funnily enough, we usually have what we call more beginner exercises, intermediate exercises, and advanced exercises, but the psychodynamic book kind of broke the mold there. And maybe that's a perfect segue to throw the microphone to Hannah and ask her, how was the process of choosing the skills to focus on for the book, writing the skills, etc., etc.
Well, actually, if you go back one PowerPoint, I had nothing to do with the cover of our book, but if you'll notice, it's the most complex cover. So I think somehow the artist intuited the complexity of doing this book, you know, with 100 years of theory and practice in psychodynamic. It was a Herculean task to figure out what point of view we'd be taking, and then what would be the skills. So you can go back to those skills, Alex. What we did is we decided to present a contemporary psychodynamic, psychoanalytic framework, really emphasizing relational, interpersonal aspects. We combed the literature to see what studies appeared that might help us come up with these skills. We sent out a survey to psychoanalysts, psychodynamic therapists, supervisors, trainers, tried to get their input, especially about skills that they thought their trainees would have difficulty grasping, doing, you know, what's been their experience. And then, of course, we reflected on our own clinical experience as supervisors and as therapists. So we came up with these 12, and I think it's a pretty good representation.
And you want to say a word, Hannah, for why this book in particular, in this book series, has no quote unquote beginner exercises?
Yeah, it just seemed like from the get-go, we were already into the intermediate category. The psychodynamic skills, you know, really involve speaking to the idiosyncratic patient. It's not like one size fits all. It's not like we can give a statement and then a generic response. So it really does require, you know, building up characters within the book, so that people will have an idea about what would I say for this particular person with this particular dynamic. So it became quite complex pretty quickly.
You want to say a few words about, again, the choice of these skills. Is there any themes running throughout the series of skills? Can it be clustered in any way? Just any thoughts on the choice of the skills?
Yeah, we have those that are more experiential, more affect-based. We have those that are more cognitive and integrative, and certainly those that are getting to the inner skills of the therapist, which is so important in doing psychodynamic psychotherapy.
So it's one thing to write about these skills and a totally different thing to practice them. I know that, of course, you know, some of my favorite psychotherapy writers have been psychoanalytical, brilliant writers all across the psychoanalytic and psychodynamic literature. But how was it then doing the skills? And importantly, just for everyone to know, testing out the skills, because you tested these with real poor trainees, didn't know what they were getting themselves into. How was that experience?
We didn't know what we were getting ourselves into, Alex. You know, Volney and Jeff, two experts in psychoanalysis and psychotherapy and brief psychotherapy. I've known Jeff for many years. And we would get into these wonderful academic discussions, right? About, well, how are we going to do this? And what were we going to pick for that? And at the beginning, we had so many criteria for each exercise that it produced such cognitive overload for the poor trainees, right? So our mission And it was a mighty one for all of us because we love talking about the complexity of this magnificent model. And it really put the burden on us to then come up with the essence, simply micro skills to really build a whole sequence of skills. It was challenging. It was challenging. And when we did the testing, what we would see is the poor trainees trying to keep in mind 3, 4, 5, sometimes 6 criteria, to be able to manifest the skill and do it successfully. And that's not what we wanted to do. We did not want to create this cognitive overload. We really wanted to get them into their bones, into the procedural learning. And so we needed to keep it simple, right? So
Can I just jump in for a second? I mean, so because we've had authors from a variety of models write books for our series, like MI, CBT, DBT, so on and so forth. And psychodynamic psychotherapy is indisputably the largest library of texts to mine from. And I mean, other models, like for example, DBT, are babies. They were invented, they were born just 20 years ago, or something like that. And there's only a few texts on them. So it's just really, really admirable, Hannah, what you and the team did to really try to stay true to the model and true to the depth of the model too. Because psychodynamic psychotherapy is really trying to go deep. And it's one of the concerns that I hear from psychodynamic supervisors when they hear about deliberate practice, is they're like, oh, is this gonna be reductionary, or is this gonna just turn people into robots? How would you answer that, Hannah, if someone has that concern, which is a legitimate concern?
definitely a legitimate concern. Even the manualizing of some of the psychodynamic psychotherapies has caused quite a reaction. So you can imagine getting it down to essential skills, people feeling like, yes, you're turning our people into technicians. This is a form of CBT infiltration. We get all of these statements. But really, when you break it down in this way, what we find is that the trainees can enter the material in a way that comes alive for them. So that as they're initially practicing these things, and it sounds kind of rote, remember this, this, and this, say it again. After a while, they start to get comfortable. They start to know what they need to do to create the skill. So now they can spend their time putting their own voice to it, having an authenticity come through, making it their own. And that is so wonderful to see. So that really earned a lot of respect, I think, among some of the psychodynamic supervisors that were reluctant at first to adopt this model with their class. They could see, in fact, how it was deepening not only their supervisees' understanding of the model, but also helping them to develop their own person as they do the model.
The person of the therapist is sometimes referred to.
Right, the person of the therapist, exactly, right.
Thank you.
Yeah. Yeah, I sometimes quote Miles Davis. I think I heard it originally from Alex, that it takes a lot of practice to sound like yourself.
Exactly.
And I think the deliberate practice exercises nicely exemplify that.
Great. If anyone's interested, buy Miles Davis's autobiography. For some reason, I had it right here. You see, Hannah, the collective unconscious always works.
Absolutely.
All right. So how about we give people a taste of exactly what it is, a deliberate practice exercise for psychodynamic therapy. And because we're doing a series of these webinars, and parentheses, a plug, go to the Sentio website and join our next webinars. They'll also be fun. Today, we're focusing on the first skill on the book, which is engaging in a therapeutic inquiry. Hannah, you want to tell us a little bit about this one?
Yes, this is one of those deceptively simple skills.
Hmm.
This skill does yeoman's work in psychodynamic psychotherapy. What we, usually these are open-ended questions, so to speak, and usually trainees think about it as, well, this is my way to learn about the person, and I'm going to learn a lot of information, and then I'll be able to write a formulation, and then, well, I'm not exactly sure what to do after that, but it's supposed to be helpful, right?
Yeah.
Um, but in actuality, it's a door into the patient's internal working model,
Mm.
right? It's how does the patient see their world? And so this inquiry is very informative to the therapist to begin to get inside what's going on consciously and unconsciously for that patient. Now, that's just one aspect of what the inquiry does. The second aspect is it builds a therapeutic alliance. You're asking these questions, you're very engaged, you're trying to be attuned. And for the patient, this is a marvelous way to be treated. Here I'm really listening, I'm listening intently, and I want to know more. I want to know more about you, how you think, how you feel, what you anticipate. So it helps with the alliance. But the third aspect is what I consider almost the most important. And that is our patients come in and they don't even know really why they're there quite often, right? They might say, oh, my wife sent me, she thinks blah, 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 or I'm kind of depressed, or, but they don't know their story. They don't know their narrative, right? They don't know what keeps them stuck. So in asking these seemingly simple questions, what you can do is help the patient begin to understand, oh, that's what I really mean. Oh, I didn't realize that's what I intended. I didn't realize that's what I expected, right? So you help them deepen and understand their narrative. I mean, some of them don't even know they're in the middle of a narrative, right? They don't have that reflective capacity. So this third aspect of really, deepening the work, the understanding for the patient is really the sine qua non, I think, of doing a good psychodynamic psychotherapy. So these simple questions in the therapeutic inquiry are designed to elucidate the therapist's understanding, therapeutic alliance, the patient's beginning to appreciate how stuck they are and why. And then, of course, it really cements the whole collaborative endeavor.
So one of the magics and difficulties of a dolor practice exercise is trying to break down a skill into practicable components. Because again, it's one thing to write a paper on engaging in a therapeutic inquiry, and different thing to dissect it into its parts, which is exactly what Hannah and her co-authors did. And already we see this is not a beginner exercise, although it's the first in the book, because it's divided into 3 different stages, you could say. So Hannah, you want to take us through this breakdown?
Right. So we could have gone a variety of ways here, but we decided to really focus in on these 3 aspects of doing an inquiry. So the first one, and I should say that there are 15 patient statements within each exercise, and the therapist responds to each of the 15 given the prompt from the client. And those are further subdivided into beginning, intermediate, and advanced statements. So more of a challenge for the therapist, usually more of an emotional load, maybe more in the here and now, something that's going to be increasingly difficult. So we decided that for the beginner 5 statements, we would have the therapist ask about missing details in the patient's narrative, or to clarify a vague or confusing part about the narrative. I think about it as, help me see it as you see it, right? And I'm a very visual person. So when someone starts telling me their story, I'm imagining it in my mind. And if my visual, image starts getting cloudy, or I don't have something that prompts me to ask about the details. But that's what I use, and other people can use, different ways of entering. The second part of the inquiry for the intermediate phase, a little bit more difficult, to ask about how the patient comprehends or understands a part of the narrative. And in shorthand, I think about, help me understand this as you understand it. First one is, help me see it as you see it. This one, help me understand it as you understand it. And then for the more advanced, we're really asking about the implications of the patient's narrative for the future. Help me see how you anticipate what will happen if. Help me see, if this happens in the future, what will be the consequences, right? So that's how we divided up the pie. Each one only has one criterion: ask about missing details, ask about comprehension for the second, and ask about implications for the future for the third.
Great. So we thought that we could do something fun with the group, with all our wonderful attendees today. So we're gonna give an example for each of these levels that Hannah described, of the beginner patient statements, intermediate, and advanced. And we're gonna give an opportunity for those who want to join to write in the chat a response, improvise a therapist response that might meet the skill criteria. And of course, we have the author herself here, Hannah, who can provide feedback on your responses. So it's a luxury opportunity. So let's start with the first criteria that Hannah mentioned, which is about asking for missing details in the narrative or clarify a vague or confusing part of the client's narrative. So let's see just an example first. Let's imagine that the patient says, "There is no one in my life that I can count on." Therapists could say, "When you said that, were you thinking of someone in particular?" And this meets the criteria that we're trying to meet, right? So client did a somewhat vague statement. Therapist tries to ask for details or clarification, right?
And
Go ahead, Anna.
let me just say here that you could also say, what do you mean count on? Right? Or tell me about this no one. What do you mean no one? So you can really focus in on any particular details.
Well, this adds to the idea that in the lower practice, it's not really mechanistic, given that you have also these different ways to meet the criteria. All right. Okay, great. So how about we try it? We'll give people a chance to try improvising a response. So let's try a different patient statement. Patient says, "My significant other said they didn't want a clingy partner. So I'm afraid to complain about how little time they spend with me." So for those of you who want, try writing on the Zoom chat a response that meets the criteria of asking for missing details or clarify a vague or confusing part of the narrative. We'll give attendees a minute to write the response.
Should I just read them? How about that? I'm going to read them out of the chat. The first one is, what do you think they mean by clingy?
Right? You're asking for a detail about the meaning of that for the patient, to clarify something that might be confusing.
Another is, can you tell me more what clingy means to you?
Right, right. We're starting to get a little bit into comprehension, but I think that certainly would help clarify a vague or confusing part of the narrative.
Hannah, can you just speak very briefly about or can you explain the difference between comprehension and clarifying?
Right. So for the details, it really is helping see it without adding in more conceptualization. For the comprehension, it's more, how do you feel? How do you understand this? Even more depth about the meaning behind it. So one is more of an understanding. How do you feel?
Got it.
Meaning, and the first one is more almost, if I were a fly on the wall, what would I see?
And why is it important for someone learning psychodynamic psychotherapy to be able to perform those as separate tasks and know when to do one or the other?
Yeah, it's not. It's really not. They are separate, so you want to know you have options. You want to know when one might serve you better than another. But it isn't like where, kind of how many angels are dancing on the head of a pin. And oh my goodness, you'll make a tragic mistake if you ask about what do you see versus what do you comprehend, right? You're going to learn valuable information. But I think at the beginning, if you focus on actually seeing, right, actually seeing what the patient is talking about. So if they say, when I'm in a crowd of people, blah, blah, blah happens. Well, what do you mean crowd? Now you're saying mean, but you don't mean it in terms of comprehension. You're saying, what I see, are we talking about 4 people?
Right.
Are we talking about 40 people, right? So I like getting into those details first.
Okay. So this is not the kind of thing where it's like, okay, if you do the wrong thing, therapy's going to fall apart or the client's going to be harmed or anything like that. But because it is a very subtle difference. But from what I know, this is what psychodynamic psychotherapy specializes in, is subtle differences and how that they can be explored through subtle technique differences of the therapist.
Right, right. The less invasive, of course, is seeing, what would I see? And then, of course, you're getting more into the patient's mind once you start asking about feelings and comprehension.
Great. Okay, I'm derailing us. Let's get back to practice.
Maybe we can see an example here. I know we had a lot of, thank you everyone for putting your suggestions on the chat. So for every, sorry, Tony, you're muted. Tony, you're muted.
One more, Hannah. So I'd like okay, so how long has this been going on for you? What would you say about that one, Hannah?
Yeah, I think that's really asking about a detail that's missing here. We start to get into meaning, but I think we could certainly put that here, asking for details or clarification.
Got it. Okay, let's go ahead.
So one thing that we also haven't mentioned, so Hannah has mentioned that for every skill building exercise on this book, there are 15 patient statements to work from. But what I think we haven't said yet is that for each of those, there is also an example therapist response that Hannah and her co-writers wrote to give everyone a chance to see what would an expert psychodynamic therapist do here. And so we'll just give you an example here. A lot of people got a variation of this. So for example, again, patient says, my significant other said that they didn't want a clingy partner, so I'm afraid to complain about how little time they spend with me. Therapists could ask for details or clarification saying, can you tell me more about what you mean when you say afraid? Right? Now, I know other people ask, can you tell me more about what you mean by clingy, for example? All of these are valid. Is that correct, Hannah?
Right, right. And also, I just want to clarify that with that, quote, expert therapist response that the participant can refer to, it's 1 out of 50,000.
Right, right. and you can still get it wrong. I mean, that's kind of the thing here, right? Is there's many variations, but there are clear questions that would also be out of the skill. Right?
Yes.
This is where feedback is so important. Okay, great. So let's see a second example here for the second criteria in the exercise. So we're getting a little bit further into the exercise. So second criteria is a different ask for the therapist. So therapists should ask about how the patient comprehends or understands a part of the narrative, right? So we have an example here. Patient says, my sister was the athlete in the family. Therapist asks, does that hold some particular meaning for you as the other child in the family? Right? So this is meeting this criteria of asking for comprehension. Anything you want to add to this, Hannah, before we move on?
Yeah, I think this example makes it clear about when we use meaning in the first, for the first criterion, and meaning here where we're getting into the conceptualization.
Right, right, great. All right, so let's try another exercise here with our attendees, those that want to collaborate. So let's think of a different patient statement here. Patient says, I will be the youngest tenured professor in the history of my department. So for those of you who want, try writing a therapist response asking for comprehension related to this patient statement.
Okay, we're starting to see some here. That sounds important to you. Why is that?
Yeah, we tend to stay away from those why questions just because the patient can feel on the spot, right? Like, oh, now I'm supposed to know why, and what if I don't know why, or if I do know why? So that it puts some pressure on knowing something. It can also sound judgmental, like you should know why. Why, right? So we tend to veer away from those and focus rather on there's no wrong answer here, right? Like we could use an example of some of the others, like what does this achievement mean to you, right? There can be no wrong answer there.
Got it. Like, here's the next one. What does it mean to you to be the youngest one in the history of your department?
Right, spot on.
Okay. There are a bunch of people said, what does this mean to you? What about what is the significance of that for you?
Right, exactly. Yep.
Okay.
Well, how do you, right? Absolutely.
Now here's one that adds a bit. I can hear that you feel proud of yourself. What does that mean to you?
Yeah, now you're taking a leap there. I like if the person said, I feel proud of myself because, then you could follow up and say, what is there about that? What is there about being proud? What does that mean for you? But here it's a bit of a leap. The person, even though they're saying it in a boastful way, might come back and say, especially this particular patient whom we develop as a personality throughout the book, he'd come back and say, I didn't say I was proud. So you'd come back with this pushback and a challenge. And of course, there's a way of dealing with that, and you learn a lot with that. I'm not saying it's a mistake, but as far as doing this particular skill, it wouldn't be spot on.
Right. And so I just want to highlight this here. What Hannah is demonstrating is how in deliberate practice, we really focus on very, very discrete skills. And this is typically unusual in psychotherapy training, where we might there could be, 1,000 responses and many of them sound good. And so you just make a response to sound good. That's not what we're doing. Is we're saying there's very specific skill criteria, and we want you to try practicing in this specific way, not because it's the only right way, but we want you to have access to many different discrete micro skills that then you can put together in a very subtle way to respond to each individual client. Does that sound right, Hannah?
Yes, and in fact, it's another skill that we have, you know, where you do make somewhat of a conjecture that the person is feeling proud, and that would be under a skill called conjectures.
Yeah. Yeah. So, because this goes to something that people learn when they're learning psychodynamic psychotherapy is that some clients respond better to conjectures than others. And it's about learning to be deliberate with your use of conjectures, right?
Right, right. So now you have an armamentarium of skills that you can use, and now you're trying to match those given where you are in the alliance, given the particular dynamics of the patient, where are you in the therapy, and a host of other factors.
If I could just say, I know I'm talking a lot, but if I could just say one thing, please, is something we hear a lot from psychodynamic supervisors is, well, what about the conceptualization, right? Conceptualization is a really big piece. And no doubt you and your co-authors would agree with that. This book does not provide training on how to do conceptualization. There are a number of great books on how to do that. What this book provides is how to, I would say, operationalize the conceptualization with skills, where you make very subtle, deliberate choice of skills based on the conceptualization. And so you're kind of getting your hands dirty, and it's not just theoretical. Like, I would do this or I would do this. You actually get to try doing it.
Right, and in fact, one of our skills is actually asking questions that will specifically lead to a dynamic conceptualization.
The behavioral component or the skill component of building a conceptualization.
That's right. Right.
All right, let's go ahead.
Great. So,
Thanks.
thank you everyone for again participating on the Zoom chat. So one example response for this patient statement would be the therapist saying, "Help me understand what being the youngest tenured professor in your department's history means to you." And a lot of people wrote something basically like this, which is great. All right, so we're moving on to the last criterion of this exercise for the advanced patient statements, and that is asking about the implications of the narrative for the future. A little bit different. So let me read the example here. Patient says, again, we're reusing actual patient statement. We can say a bit more about that also. "My significant other said that they didn't want a clingy partner, so I'm afraid to complain about how little time they spend with me." Therapist says, "What do you imagine would happen if you did complain about how little time your significant other spends with you?" So this is very interesting. Same patient statement, different micro skill, effectively. You want to say anything about this, Hannah?
Yeah, I did this on purpose, you know, actually using the same prompt, the same client statement, to show that there are so many ways to go. It's not a one-to-one correspondence, right? There are so many ways to go, depending upon, again, all those factors that I previously mentioned. And this will give the trainee the awareness that they do have choices to make about where they go. I mean, one of the biggest fears about beginning therapists, and maybe some of us that are more advanced, is that we get in and we're doing the clinical work, and now what do I say? What do I do? And so we're giving this range of possibilities that trainees can draw from, right? And giving the same prompt really allows us to show that.
Love it. Well, it's like learning different scales for the same chord. I can't help it. All right, wonderful. So let's give everyone a chance to try this out. Last opportunity to join in. So same criteria, asking about implications. New patient statement. Patient says, "To be honest, I'm disappointed that you're not a real psychoanalyst." Ooh. All right, let's give people a minute to try writing a response on the chat.
Here's a response, Hannah.
Yeah.
How would seeing a real psychoanalyst impact your life moving forward?
I love it, right? The implications just turned it a little bit, and taking a look now for the narrative for the future. I mean, you can just see we are going to learn so much about how that person puts their world together just from that simple question, and then you'll get quite an answer. So yes, that's splendid.
Here's another. Sounds like you think I won't be able to help you. What do you imagine I won't be able to do?
Yeah, now the fact that the person had to say two things indicates that they felt they needed to build a platform on which to put the first thing so they could go to the second thing, right? So it's a kind of two-step. And I would say that's starting to get into another skill. Again, making an inference, building a case, making a conjecture, and then going.
Okay. Let's see. What do you imagine having a real psychoanalyst would mean for your therapy?
Right. Excellent.
Here's a different one. Tell me more about your disappointment.
Yeah, tell me more about your disappointment. So here we might be getting more into the meaning about this, right? So that would be taking a snapshot at the present time. Tell me about your disappointment. So that would be criterion 2, or the second example that we gave. This really implies the future. So not at the present, tell me about your disappointment, right? But tell me what the implications for the future that disappointment has.
Great. Here's another one. Am I to understand that you are not happy with how our sessions are going?
Right, right. Again, an excellent intervention, and one that, certainly wouldn't be too far afield, not too much of a conjecture to say something like that. But again, it's focused more on the here and now, and maybe just to tweak it a little bit, the implications for the future. Am I to understand that you might not be happy with how our sessions will proceed?
Got it.
I want to highlight something at a meta level. If we were to be doing, let's say, an open-ended role play, just going kind of back and forth between client and therapist, there would be no possibility for a trainer like Hannah to be giving this level of detail to therapist interventions. It's really because we're working at this very nuanced level of one patient statement, one therapist intervention, that the trainer can give such concrete feedback. That is very different than most role plays and experiential training in our field, right? But notice the rich feedback, the amount of feedback that we can get with just focusing in on one single therapist intervention.
Yeah.
And
Go ahead, Anna, please.
yeah, I might just add in here too that we're building through the book. This is the first exercise, and there's a level of sophistication here, I think, that we're starting to build things that someone will be able to see a few exercises down, how they pay off. For example, in our formulation questions, right? Expectations for how other people will respond becomes a very important aspect of the formulation. And here we're starting to build that in. What are the implications for the future? How do you see things unfolding? So we're already seeding that here, and then we're really going to hone in on it later on with the formulation.
Yeah, this is a great example, going back to what we were talking about earlier about concerns that deliver practice would be reductionary or, make psychodynamic psychotherapy mechanistic. We're seeing quite the opposite, right? We're seeing a very rich and subtle approach to word choice. It's very nuanced. We're seeing people have a variety of different responses in the chat, and Hannah, you're providing, very subtle commentary like, oh, this is a little like this, or this is a little like that. And I mean, none of these have been like totally wrong, right? Or totally off. It's really just a lot of subtle nuances.
Right, right.
We should probably also mention that we're even doing, I should say, a variation on the traditional deliberate practice activity, because here we're asking participants to write their responses on the chat. In actuality, if you pick up the book or do deliberate practice, what you'll be asked as a trainee is to actually do it, right? To actually say the intervention out loud as if you're with the patient in front of you. Now that adds a whole other layer of feedback that Hannah could give here regarding, for example, tone of voice, right? Or inflections, etc., right?
Yeah, because I'm reading them off the chat, and so my voice is kind of flat, and so it's really reduced compared to authentic deliberate practice that's, you know, face to face.
I love Mackenzie's comment on this chat that if they were to do it out loud, it'd stumble on verbal fluence basically immediately. Yeah, thank you, Mackenzie. This is something that we have found. I think it happens to basically everyone. We're always more eloquent in our own mind than we are when we talk out loud or when we're writing. Exactly. Everything sounds so much better in the isolation of our heads.
But this is one of the aspects I love about deliberate practice, working with the trainees, because at the beginning, the verbal fluency isn't there and it sounds very stilted and, you know, very robotic. And then there's the flow that starts developing, you know, oh, I get it. Now I see it. And with that flow, then, you know, they can see the difference. And that's very reinforcing. Thanks, Mackenzie.
And part of what Mackenzie's I'm possibly referring to is when we're performing these skills, our anxiety can go up. And then that can impact our ability to deliver, you know, verbally something that we might be able to do quite well, or, you know, typing or paper and pencil without a human being affecting us. And that's part of the goal of deliberate practice, to do what's called state-dependent learning, where we're learning to perform skills in an emotional context that's somewhat similar to we'll be sitting in with real clients.
Yeah.
So I know we're just about to start wrapping up. I want to make sure to leave on the Zoom chat a link to the book itself that we've been focusing on. A reminder that this is just the first in a series of webinars. So like Hannah was saying, each exercise builds on each other. So if you want to get an additional challenge, join us on the next webinars, because we're going to keep upping the ante. I'm also going to put on the Zoom chat our supervision, deliberate practice supervision residency for those of you who are also interested in deliberate practice supervision. Arguably an even harder form of deliberate practice that Hannah is also familiar with. And I'm kind of curious, Tony, Hannah, any kind of last thoughts, reflections as we're about to start wrapping up?
Hannah?
Well, just that my own personal experience, this is almost my 50th year doing therapy. So what I can say is that getting into deliberate practice, writing the book, going to the supervision sessions that Tony and Alex hold, has really enlivened my work. You know, you might think, oh, after 50 years is in this kind of road and da, da, da. This has really enlivened it. It's made me more skillful. I think a great deal about the concepts, and actually if what I'm saying or doing mirrors the concepts, or maybe not, maybe the concepts need some tightening, etc. So just to put in that aspect, that even for experienced therapists, I think this is an excellent routine. We're not leaving out anything. I think all the other aspects of training are marvelous, but I think adding this in will be an addition for you.
Thank you.
I hope so.
I would just like to say thank you to everyone who participated in today's webinar and courageously put your responses in the chat. It's wonderful to have a worldwide community join us today, and please join us next month and future months. We're very excited to have Hannah back and continue this series.